Well, hello and welcome. You're watching India Fights, back with me, Rajat Kain. In this episode, we'll take up the issue of drugs for adults. Are they suitable for children or they're not suitable for children? What is science behind it? What has been children's response towards the infection? Now, in a latest order, the government has come out with the guidelines for operationalizing COVID care services for children. Drugs such as ivermectin, hydroxychloroquine, favipiravir or Fabiflu, and antibiotics like doxycycline and azithromycin prescribed for adults in COVID-19 patients have not been recommended for treating children. Several of these drugs are also being put on a second thought if these drugs could be used for treating even adults with COVID-19 at all or not. Now, according to government guidelines issued on Wednesday, the Union Health Ministry said most drugs used in adult, such as ivermectin, hydroxychloroquine, Fabiflu, and antibiotics have not been tested on children for prevention or treatment of COVID infection amongst them. So, what are the best suitable drugs, if at all, needs to be administered to children who are affected by COVID-19? To discuss further on this extremely important issue, we're joined with Dr. S.K. Kabra, member National Pediatrics Task Force for COVID-19. Many thanks to Dr. Kabra for joining us. And Dr. Mamta Jaju, she is Professor of Pediatrics from Chacha Nehru Bal Chikitsyalaya from New Delhi. Many thanks, Dr. Jaju, for joining us. Let me come to you first, Dr. Kabra. Sir, in terms of COVID infection and how they have affected children's immune system, what have we noticed so far?
Yeah, Rajat, you have asked a very pertinent question. And as we are aware that this COVID pandemic started somewhere in early months of 2020. At that time, none of the physicians had any idea about what are the clinical manifestations, what are the drugs to be used, and how it will evolve. So over a period of time, multiple drugs were suggested by their test in the laboratory that these drugs may be effective, including hydroxychloroquine, maybe remdesivir, maybe lopinavir, ritonavir, favipiravir, all these things. And then there were some clinical trials carried out specifically in adults above age of 18 years. Now we have enough evidence and randomized controlled trials that none of these drugs, though they have not been tested in children, but none of these drugs are have any role in pediatric patients. One is that we do not have an experience of these drugs, whether they are safe and whether they cause any benefit to the patient. On the other side, we do not have a definite role even in adults. So that's why over a period of time, we have a various evidence-based guidelines for management of children. And one of these things is as released yesterday by Director General of the Health Government of India, and it divides children into 4 groups. One is those who are asymptomatic. They do not require any treatment, but they require monitoring at home by parents. And in case there is any deterioration or development of some symptoms, they should contact a physician or a pediatrician. Another major group is mildly affected children or mildly symptomatic or just having some cold, cough, sore throat and mild fever or low-grade fever. These children also treated at home unless there is no feasibility of managing them at home because of some elderly person having a high risk, or there is no facility for monitoring at home. In that case, they may be monitored in a COVID care center. And they do not require any of these antiviral drug, antibiotic, or any other modifying agents. Then the third one is moderate to severe. They require hospitalization in a COVID hospital, and they require again a supportive care. Government of India guideline clearly suggests that they require only a basic investigation if indicated. No unnecessary investigation. I would like to clarify
Okay.
that there is no role of CT scan in diagnosis or management of children with COVID, so they should not be done. If indicated, then it will be done in consultation with a specialist. So these are various guidelines which suggest or which clarifies that what to use and what not to use. And it's very clearly defined that there is no role of remdesivir, favipiravir, no
Right.
role of tetracycline, azithromycin, or remdesivir. And it is just a simple identification and supportive care if child is having a moderate to severe disease. Thank you.
Right, sir. Right, sir. Dr. Kabra, many thanks for your opening remarks. Let me go off to you, Dr. Jaju. Dr. Mamta Jaju joins us from Chacha
Yes.
Nehru Bal Chikitsalaya from Delhi. Ma'am, many thanks to be a part of the show. Ma'am, so far we have seen 1.5 years of this pandemic. What has been the percentage of children that we have noticed so far who have been, say, seriously affected by COVID-19 and the ones and overall, what has been response of the immune system towards this infection?
Yeah, so thank you, Rajat, for asking this question. So, just want to clarify that as we are moving towards the third phase, we have seen that in the first and the second wave, the most of the time when it is the community spread, we have seen the percentage of the children affected through the disease are very less in number. So, in the first wave, it is around 2% of the total affected, and in the second, it is around 12 to 14% of the affected. So, and in most of these patients, the children, they are either mildly symptomatic or asymptomatic children. So, the important thing to remember in cases of children, if they don't have any associated comorbidities in the children, so mostly they are asymptomatic or they have mild symptoms of any viral illnesses, which usually children have, like the cough, motions, vomiting, such that. So not to worry about in any case, but we have to be, as the Kabra sir said, that the parents should know about the disease and what to do in identifying the disease is very, very important.
Right.
But not to panic in any case, and they just know that it could be COVID or it could be a simple viral infection. But the other important thing to know, very important, is that if the child is having any comorbid illness like the obesity, that is very, very important, associated diabetes, or any kidney diseases, or any chronic lung diseases, or prematurity leading to the malnutrition or other things, so then they have to be little alert in that condition, because in associated comorbid patients, as we have seen in the second wave also, the mortality has happened in the children, and severity has also happened in few of the patients, but only if they are having any comorbid illnesses. So not to worry about in any case, because it is only mild to moderate disease. But if the patient is having some comorbid illnesses, then they have to little alert about this thing. So
certainly, right. Dr. Kabra, among the guidelines, there are several drugs which are administered to adults, but they have been not recommended to be administered for children. What possible reasons are there for those? Besides, of course, they haven't been tested on children.
Okay, one is that they have not been tested in children. Second is that they have not been found to be very useful even in adult patients. Say, whatever meta-analysis means, when there are multiple trials, they are combined together and then the results are analyzed. So it has been found that whether you give a hydroxychloroquine for treatment or prevention, whether you give a ivermectin for treatment or prevention, or for treatment remdesivir, none of these have been found to be useful in any age group, and they have not been tested in children. If we use adult patients, general prescription is tetracycline, azithromycin, ivermectin. So as I said, if we use unnecessary drugs like antibiotics, tetracycline anyway should not be used in children below 8 years of age because of their side effects. They affect the teeth as well as their bones. And if we use unnecessary antibiotic, then we may be inviting infection subsequently with a resistant organism, resistant bacteria. That may create more trouble than
Okay.
any benefit to. That's why a conscious decision after discussion has been taken that these drugs do not have any role. If there is a suspicion of infection in a moderately severe or critical children, then according to the bacteria, we decide about giving the antibiotic.
In terms of say, vaccination, of course, like we are at the stage of clinical trials. So, I mean, if you are privy to any results, how promising or forthcoming they are, sir?
As of now, there are no results are out from trials carried out in India between 2 years to 18 years of age. They are ongoing. Some centers are screening, enrolling, and then following the children. I expect that the results of these studies should be available in next 3-4 months time, and then they will
Okay.
be cleared for use. The other one is regarding uh, these trials done outside for age group above 12 years of age, and they are more or less similar to that of a adult age group above 18 years of age.
Right.
So we expect that there will be results of trials in children between 2 years to 18 years will be available soon, and there is no reason to expect that it will be different from adults. But if you are using a drug which is new, including vaccine, then it should be tested for its safety as well as efficacy, specifically vulnerable group, including children. Thanks.
Right, right. Dr. Jaju, in terms of understanding the correlation of the infection with children, overall, what we have seen so far, the immune response of children, and of course, like I mean, so far as you know, even in the last reply you mentioned like about like in the 1.5 years of COVID pandemic. So what this study of 1.5 years of correlation between children and infection would help us in understanding the virus per se in the longer run.
So the first thing is that the protein of the virus, which affects mostly in the adult, the receptors of which are not very responding to in the children. The
Okay.
severity of the illness is very less in the children, but it's not like that it is not happening in the children. It is happening in the children, and sometimes it is going to be the severe. But the important one disease which I need to cover in this question is that the post-COVID, the illness which is MIS in children is getting very common. It is a multi-inflammatory syndrome in children, and it is usually in the children who are COVID positive, asymptomatic or symptomatic. After 3 to 4 weeks, the presenting with high grade fever, they have loose motions, they are having multi-system involvement, sometimes like the eyes, redness of the eyes, skin rashes, and heart involvement, kidney involvement, and other all. So it is like the presentation of the Kawasaki disease. But now many of the cases we have seen in the first phase we have not able to identify many of them. We must have missed them because it was a new event coming out, and mostly we are making the diagnosis of Kawasaki disease. But this after this wave, nowadays we are seeing a lot of patients of MIS, and we were able to identify these children. We are able to treat these children. It's a very severe the presentation when the children are presenting in the hospital. Most of them are in the hypotension, they are in the shock, and there is heart involvement. But still, even after identification, if the proper treatment has been started on time, the outcome of these children is very good. So this is very important to identify these babies because it is mostly after 3 to 4 weeks of COVID infection. So if somebody has suffered from the COVID infection in the family, and the children, though they have not been investigated for the COVID, they might have got the asymptomatic infection. But after 3 to 4 weeks of that infection, if they are presenting with the high grade fever or something like the redness of the eyes or the rashes or the diarrhea, the parents need to get alert, and these children should be brought to the hospital for further checkup and the examination. This
Right.
is very, very important.
Right. Dr. Jaju, before I broad-based discussion, of course, like talking about the hypothesis of the third wave, the possible third wave. Let me ask you one small question here, ma'am. As we have seen, different variant of COVID has reacted differently on adults, given its severity and spread. Have you seen a similar phenomenon on children as well? Overall, worldwide, not just here in India.
Mm, so maybe because I have not gone through many of the studies which has proven that the different variants in the children, but could it be the severity, as the severity of the mutants we are seeing different in different variants? So might be the some children who are having some severity of the illnesses have that type of variant. So
Right.
I can't answer it surely,
Sure,
but
sure, sure.
maybe Kabra sir can give you.
Right. Dr. Kabra, your take, I mean, does the mutants or variants also have a different reaction on children based on their immune system, as we have seen among adults?
There are various hypotheses going on in scientific circles as well as in social media, but as of now, we do not have a concrete evidence to say or support this hypothesis that they behave abnormally in children. And rather, this is one of the hypotheses or one of the suggestions given for the third wave, which will be more severe in children. But as of now,
Right.
we do not have any evidence to support this hypothesis. So all these are hypothetical. In future, we may get some details, but as of now, I'll say there are no evidence at all for this, that children will behave differently or the virus will cause different type of illness in children.
But as we read more and more such reports, like we're preparing quote unquote for third wave, and especially like it'll impact children. So what possibly this preparation could mean, sir?
Yeah, there are two aspects to it. One is that whether there will be third wave. Second is whether it will affect more children and severely, and what we are preparing for it. So let us see first. If we see the history of Spanish flu in 1918, there were multiple waves. And now also we are seeing across the world that there are multiple waves. We are just recovering from the second wave. So theoretically, there is a possibility of the third wave as well. And we should be prepared for it. So how we are preparing ourselves? So there are two aspects for it. One is that if there is no evidence to support that it will affect children severely, because the hypothesis given for more severe disease in children, one we have already discussed, that virus mutation. Other thing is, people say that in next 3-4 months, all the population above 18 years of age will get vaccination, and so they will become immune. Only group which remains susceptible is below. And the third thing is that in first and second wave, all adults have got infected, but children are not infected. So now let us see one by one. First is that there is no mutant which will behave abnormally and cause more severe and more illness in children. Second thing is about the vaccination. We will get the vaccine for children very soon. And as children will get infection from the adults, so if adult population is immune, then the chances of children getting is less rather than more. Then let us see the third thing, that most of people above 18 got infected in the first and second wave. That is totally wrong, because the serum serosurveillance suggests that children above 12 years of age has antibodies more than that of a general population, 27-28%. So it suggests that children got infected either mildly or asymptomatic. So none of these three hypotheses support that children will be affected more. Now we come to quickly that what preparations we have to do, even if the third wave occurs for children. So one is that, as Dr. Mamta clearly defined very beautifully, that there is a other disease which is part of COVID infection, late manifestation. So one preparation we have to do is for the acute COVID infection. So these are the children will be treated in a acute COVID hospital. So we are preparing that each hospital, whichever is providing care to the COVID infected children, there should be a separate area for children so that their parents can stay with them with the due precautions, because children need care by the parents rather than taking them away from parents, which will create more trouble in form of managing them as well
Right.
as subsequently psychological problems. So that is one, that we will prepare a separate area for pediatric patients. And as you may be aware, Government of India has already prepared a document to augment the services of COVID infection in children, starting basis from the ASA workers, ANMs to PHC, CHC, district hospital, as well as medical college. And a detailed white paper has been prepared and circulated that how they have to prepare the infrastructure, including how many beds, what equipments are required, and training of nurses and other people. So that is one. The second aspect is this MISC, or multi-system inflammatory disorder syndrome in children. That is a new disease described in April 2020, and now more and more people are recognizing it. And we expect that in the next 2 months or so, there will be more children because of the second wave infected in the second wave. These
Right, sir.
children are non-infectious and they are managed, they will be managed in the main pediatric department of hospitals, which may be medical college hospital, district hospital, or other hospitals. So for that, the Government of India is enhancing need for HDU beds and ICU beds for these children.
Right,
And as
right,
well
right.
as they require expensive medicine, including IV, IgG, methylprednisolone, so that the government is trying to procure so that there is no scarcity of the medication in the market or in the hospital. So
Right,
this
sir.
is
Right,
the
Dr.
outline
Kabra.
of how we are preparing ourselves for facing the third wave, and specifically how to take care of children due to third wave.
Right, right. Dr. Kabra, this is extremely important and elaborate explanation of several hypotheses, including third wave. Dr. Jaju, as we close the show, ma'am, your take, again, just discussing further this hypothesis of third wave and this impacting children, what all we need to be careful about, like parents need to be careful about, children themselves
Yes.
need to be, what signs and signals they should read at first sight?
Yes. So this is very, very important. So this is, we know that it is a scientific prediction that third wave might come, and as we know that adults are mostly vaccinated and developed immunity, so might be it is the children who will get affected in the third wave. So important is that we are getting enough time to prepare ourselves. So as sir has explained it, that as per the related to the hospital services and the infrastructure, government has already started taking a lot of actions and they are all in progress. So prepare the COVID wards in the COVID hospitals for the pediatric wards and taking care. The other aspect is how to prepare the parents and the children about this disease is also very, very important. So the first thing is like because the COVID vaccination for pediatric age group, we know it will take a little more months to come. So the prevention is very important, and educating the parents about the disease is very important. Identification of early sign and symptoms. The first thing is very important is to have COVID appropriate behavior
That's important.
that should be taken by all children, pediatric age group, and the parents, which is very important. So, like as per the WHO, which says that all children above 5 years should wear masks. So the parents and the other people, they should make to teach that how the pediatric age group should wear properly mask. So they should be like giving the proper education to the kids to wear the mask properly and not to touch their hands over the nose or the mouth repeatedly, not to touch the mask repeatedly, wash hands after removing the mask properly, and even if they are going out for playing in the play areas, they should be a little separate away from other children and always wear masks when they are in
Right,
the outside the home.
right,
The
right,
second
ma'am.
very important is to teach them the proper hand washing, so that they need to wash their hands at least for 20 seconds after coming home, whenever they are coming inside the home, and how to remove their masks and wash their hands with the soap and water. So the COVID appropriate behavior in every sense is
Right,
like
ma'am.
wearing masks when they are going out, even for the birthday parties, you can't avoid them. You can't keep them inside
Certainly.
the house every time. So it is very important for the parents to educate their children to have the proper COVID appropriate behavior whenever they are going out. The other thing which is very important for parents to identify the early sign and symptoms of the disease.
Please,
The
yeah,
first
yeah.
is the early, like the mild or moderate COVID, acute COVID infection. So mostly in the children, they are presenting with the fever. So it is mild or moderate grade fever. And the second is maybe they will present with the loose motions or the stuffy nose, etc. But the important thing that they need to remember is that they should not start any drugs on their own. It's the only safe drug which can be given under COVID in children is the paracetamol, which they can continue with. Otherwise, they should not start any drugs. But they should keep a close observation on the children, like the monitoring of the temperature. If the children is having
Right,
persistent
ma'am.
high grade fever, they should be careful. If the
Right, Dr.
baby
Jaju.
is
I'm
having
sorry,
a
ma'am.
respiratory distress,
Right,
respiratory,
Dr.
so
Jaju.
they have to be careful.
Yeah, I'm afraid we have to wrap it up here, but certainly very valid and extremely valuable suggestions and caveats that you have brought forth for children as well as their parents and society at large. So basically, as we close the show, again we appeal to our viewers who are watching the show as the experts here, Dr. S.K. Kabra and Dr. Mamta Jaju. Just like all the doctors from medical fraternity, they become part of the show. They keep urging us, all of us, to maintain physical distancing, keep washing our hands, maintaining sanitization, and of course, do not forget to wear face masks. Remember, all these things are simpler things that can help us in defeating this pandemic or at least keeping it at bay. Well, many thanks, Dr. S.K. Kabra, and many thanks, Dr. Mamta Jaju, for joining us. Thank you. Goodbye.